Thank you, Mr. Chairman, and thank you to each of you this morning. Truly appreciate your testimony, your work, and just the effort to deal with this epidemic, pandemic, as we have been describing it. Senator Bennett mentioned that so much of the challenge in many of our states is the rural aspect. And it may be that you can get coverage for treatments, but if you can't get to the treatment, it's pretty difficult. Ms. Boz, you acknowledge in your recommendations that many individuals living with substance abuse disorders don't have access to transportation. You just can't even get there. One of the things that we've been working on in Alaska, because again, we simply don't have sufficient treatment that is available, and the distances are limiting. The FDA has just recently approved a device that is called the Bridge device, and we've been working in certain areas to, it's an ambulatory detox model, and through the use of the Bridge device, which reduces the symptoms of those that are going through withdrawals, along with medically assisted technologies, the MAT, using Vivitrol and counseling. We've been trying to use this as this effort to fill the gaps until we're able to get more treatment facilities that are online. We've got the potential for additional facilities, additional beds coming on, but it may be 2 years from now, maybe even longer than that. And as we all know, none of these individuals have 2 years to wait. So being able to share some of the pilots that are going on in different areas, particularly as we're struggling with how we deal with the realities of rural restrictions, things that limit us from any level of treatment whatsoever. I will note that in our state, the benefit that has come to us in being able to treat more through Medicaid expansion has been quite significant for us as a state. I wanted to ask a question that Secretary Tilley, you reference in your written testimony, but you just kind of skirted by it, and that is the issue that we're beginning to see with outbreak of whether it's HIV or hepatitis because of the needles that are being used to inject heroin. I'm actually going to be meeting with a member of our state Health and Social Services Department with a specific focus to the syringe services program that we are trying to implement in the state of Alaska. Can you, or if others have more information on this, because we're dealing with an opioid epidemic, but again, are we also leading ourselves to a hepatitis epidemic, a resurgence of HIV? Can you please speak to this?
Yes, Senator, I absolutely can. In Kentucky, we became the first southern state 2 years ago to legislate a comprehensive statewide program. Many, very controversial. Again, I think people thought I had 3 heads when I stood up on the House floor when I was in the legislature to talk about it for the first time. And I did that, and now we have 41 programs in a state, again, that is in desperate need of this because our Hep C rates are 7 times the national average. Our HIV rates are off the charts. Of the 220 counties most susceptible, according to the CDC, of a rapid HIV outbreak, 54 of those counties are in Kentucky. The senator from Indiana mentioned the problem right across the river from Louisville that happened in Austin, Indiana. Many of you know by now, with rates of HIV and their outbreak like that of sub-Saharan Africa. And that was instructive to us on how close we were to that kind of public health nightmare. And so we're proud of this effort now to move forward in that. I would say as it relates to corrections, we don't treat now without symptomology. If there would be some requirement to do that, and this applies to many states around the country, moving forward, I don't know how existing tax bases could withstand an additional, in our state, $100 million burden to treat for Hep C on the front end without symptomology, which, again, we can do today. And so again, to say that, again, you've hit a nerve, you absolutely have. So to anything we can do in the public health arena to cut down on the bloodborne illnesses is critical to this entire problem.
Thank you. Thank you, Mr. Chairman.